Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
At this point in my career, I have never asked why IV nutrition, but I think it's important for you to ask that question of yourself. If you're an integrative healthcare practitioner or any practitioner that has a wellness goal for your patients, the question shouldn't be, why should I do IV therapy nutritionally? But you should be asking yourself, why am I not doing IV therapy? Hey, I'm Dr. Mitch Gann, and thank you so much for joining me. And I'll try to give you as much information in this field, which I have written basically the only textbook in the world. Yes, to do IV nutritional therapy, you do need to do education. That particularly helps you with two areas, safety and efficacy. But the benefits that are afforded your patients pretty much are immeasurable. I have used IV therapy for hundreds of thousands of different treatments for different patients, and I find that without it, I would never be able to stay in front of you today and explain what I will now. I want you to consider that an oral nutrient, whether it's a vitamin, a mineral, or an amino acid, is basically poorly absorbed for the most part, and that it is even in youth. Now, even if you have the perfect gut, the perfect GI situation to swallow an oral pill, you still have to realize that there are other factors that are seriously involved, and they could be stress, your age, lack of stomach acid, interfering other drugs, malabsorption type syndromes that anyone can have, the use of alcohol, poor vitamin manufacturing to begin with, the one that was prescribed for the individual. There are fillers, there are food colorings, there are dosages that are improper. There are poor food choices people make, antibiotic usage that will interfere, drinking chlorinated water, of course, soda. Well, you get it. And that is compared to this oral way of doing things, which I'm not telling you not to do, but to immediately start, in my opinion, with the intravenous route, that gives you 100% absorption. So are we talking somewhere between 5 and 40% absorption, or would you like to see 100% absorption in your patients, especially if you're using these nutrients as part of a clinical program? There's so many problems that our patients have. They include inflammation, endothelial dysfunction, autoimmunity, viruses, bacterial overgrowth, and with all of them lend themselves pretty much to the diseases that beset pretty much most of humankind. Now, I realize 42 years of integrative practice and pretty much thousands of patient encounters that the only way to effectively and in a timely manner and an enduring positive medical manner to get a positive change for the patient is by applying sound nutritional and medical applications. Only way for me that I've ever seen to do this is utilizing the intravenous route of administration. It's one of the most viable means for you to use in your practice. It will bring you whatever your specialty is to the forefront of that specialty, because your results will be much more viable. They'll be much more obvious than someone else in the specialty not doing that. Now, you should expect remarkable improvements within your patients within 30 days. And the great news, which is really great news, is that IV nutritional therapy does not contradict or interfere with conventional medications on the whole. So again, at the end of this video, I ask you again, why aren't you giving your patients the best of all worlds when it comes to their health care? If you're not doing IV repletion, why not consider doing that as soon as possible? No excuses. If you want more information, just go to drmitchgann.com. That's drmitchgen.com. And you'll find the answers to the IV problem or issues that you may want to consider and get started in your practice with this very helpful therapy. Thanks for watching. I'm Dr. Mitch Gann.